Innovation has always been at the heart of how Singapore transforms itself in an increasingly complex and uncertain world. Our ability to work together and innovate will allow us to seize new opportunities. In partnership with the Ministry of Health, Enterprise Singapore is happy to announce the launch of the Healthcare Open Innovation Challenge. This collaboration brings together our public and private healthcare providers, the industry, and the government to solve real-life problems faced by the healthcare system.
Here at HMI, we're looking for solutions that will transform the patient experience, both from a patient satisfaction perspective, as well as from clinical outcome results. It's important to us because patient expectations are changing rapidly, and we want to be able to meet those needs and help them live better lives, not just cure the problem itself.
We are looking for innovative solutions to address challenges in the areas of pharmacy service experience, patient care prioritization, and operating theatre resource optimization. This is important to SingHealth because patients are at the heart of all we do, and we are committed to pursue innovations that transform and advance care for our patients.
We are looking for innovative solutions to address challenges in the areas of improving medication compliance and preventing falls and excommunication from our centres. This is important to St. Leonards Elder Care because we wish to holistically care for our elders by creating a safer and supportive environment to build independence and health. This will facilitate graceful aging for our elders and grant a peace of mind to their family members.
We're looking for innovative solutions to address challenges in the areas of operation resource planning using predictive analytics, inpatient medicine supply processes, and inventory management. These are important to NUHS because we want to reduce human error, leverage operational and cost efficiencies to achieve better clinical outcomes.
We're looking for innovative solutions to help address the challenge of managing medication adherence amongst our patients. This is important to NHG because it's recognized that poor adherence to treatment is associated with poorer care outcomes. At the same time, knowledge of patients' adherence levels drives more accurate decision-making for chronic disease management.
Technology and innovation will empower the healthcare transformation that the MOH family is pursuing to go beyond healthcare to health, beyond hospital to community, beyond quality to value. And we want to achieve all these despite our aging population and a shrinking local workforce. I'm glad to see that our healthcare professionals embrace the power of technology and innovation to put Singaporeans at the heart of all we do. I look forward to new ideas and solutions from the Healthcare Open Innovation Challenge.
If you're an innovator, entrepreneur, or visionary that's really take up this challenge and make an impact on healthcare, visit our website to find out more. Let's shape the future of healthcare in Singapore together.
Now we shall formally open the info session for the inaugural Healthcare Open Innovation Challenge. We would like to invite the Director of Healthcare and Biomedical of Enterprise Singapore, Audrey Look, to share a few welcome remarks.
Hi everyone. Thank you for joining us for this Healthcare Open Innovation Challenge info session today. The Healthcare Challenge, as explained in the video, is really part of the National Innovation Challenge that was announced at the Fortitude Budget by DPM Heng. The impetus for this is to help sectors transform in view of the disruptions and opportunities brought about by COVID. But really, it's not just about COVID. It's about how we're going to look at doing things in a new way, in the new normal. Things like digitization being more mainstream. How can we be more, seize opportunities in those trends that we are seeing? But at the same time, also bearing in mind that there were many blind spots that were raised during COVID. And across sectors, every sector had to transform to make sure that we end up or become more resilient as a process of this. And so first, I'd like to extend my deep appreciation to our corporate partners, SingHealth, NHG, NUHS, HMI, and St. Luke's. We put this challenge together in the 3.5 months, so this would not have happened without your strong support. I would also like to make special mention of our organising partners, Ministry of Health, National Health Innovation Centre, and last but not least, Pada & Co, who have been working diligently behind the scenes. Open Innovation Challenge is not a new concept in healthcare. In fact, our public healthcare clusters have been organising this under various names. NHG has done 2 rounds of Open Innovation Challenges across the last 3 years. SingHealth has been launching regular calls for collaboration under SME Connect, and NUHS themselves also have their regular Innovation 360 events. So this is not new. But what differentiates this challenge from what we have been seeing in the past is, for one, this is the first time we are bringing together both public-private healthcare players onto a similar platform to raise their needs. Second, This is the first time we are identifying common problem statements across more than one corporate partner. And what we hope to achieve by putting together all these different corporate partners is, for one, that the solutions we identify or the problems we identify are worth solving and are meaningful. Second, the solutions that are developed will be one that can bring about greater impact than just across one corporate. Third, that the cost of adoption will be lowered because of economies of scale. And with this hypothesis in mind, we launched the Open Innovation Challenge for Healthcare. And here we're very glad to see the strong support we received both from the corporates as well as from our ministry partners, and of course from solution providers like yourself. We hope that these sessions will be informative for you. We thank you once again for the time spent, both from the clusters and the healthcare providers who have taken time to be here to clarify any questions you might have. But we also like to thank the potential solution providers that will be coming in to provide new ideas, new solutions to how we can solve these challenges together. And with that, I wish you all a very fruitful session. I look forward to seeing all the new ideas that will come up from the challenge. Thank you.
Thank you, Audrey. Very happy to see this Open Innovation Challenge launch, and we shall proceed to the agenda. So for today, we'll spend about 5 minutes to just tell them a little more about the program, how it's structured, the opportunities for innovators such as yourself. And at 3:45, we will start off with the industry track sharing by SingHealth and NUHS on operating theatre resource and patient monitoring. At 4:15, we would do an industry track sharing for a second industry track statement, medication traceability and compliance. At 4:45, 4 concurrent rooms will be opened, and in each room there would be a sharing of enterprise track challenge statements. No worries if you have more than one challenge statement you're interested in looking at. The recordings would be made public on the healthcarechallenge.sg. So now we will start with the introduction to the program. So this innovation challenge would have 2 tracks. We have 11 challenge statements in 2 dedicated tracks, the industry track and the enterprise track. As Audrey has mentioned, industry track are challenge statements that have multiple challenge owners, and enterprise tracks are where there's one challenge statement owner per challenge statement. So we'll be hearing more about these challenges from challenge statement owners today. So you can submit your innovative solutions and stand a chance to co-develop, test-bed, and pilot solutions. The winner of each challenge statement owner will be awarded the Enterprise SG grant of 25K, and thereafter, depending on the challenge statement that they are gunning for industry track challenge statements, up to $1 million is allocated to the selected enterprises, and the remaining of the up to $1 million is allocated to support the adoption of the co-developed solutions. And for enterprise track funding, the enterprise development grant would be made available to support the co-development and piloting of the solution. So we look forward to all your submissions by the 22nd of December. Here's the process. So we are currently at the 1st December is the info session. So 21st December is the submission deadline, and we will be shortlisting the results for demo preparation in January to early March. And in early March, we'll aim to have the demo day, and we'll announce, and after going through the evaluation, we will announce the winners in end March. So these are the 4 broad selection criteria for shortlisting. It's also available in the FAQ section on the healthcarechallenge.sg website. So we'll be looking at 4 broad criteria before we decide on a shortlist process: the effectiveness, feasibility, innovativeness, and credibility. And after this selection process, when you are shortlisted, every 3 solution providers per problem statement will be shortlisted for demo preparation process. And then we will have the demo day. So this is, feel free to use the QR code here to look at the submission guidelines and the submission form. Everything is readily available on the healthcarechallenge.sg website. If you have any questions, please feel free to share with us through the inquiry form, the website, or through this Q&A function on the Zoom function. Okay, next, we will start with the industry track challenge sharing. So how the format of the challenge of the sharing would go would be a 15-minute joint presentation, and then there would be a 15-minute Q&A from the audience. So we feel free to, throughout the presentation, feel free to use the Q&A function to ask any questions that you might have. So I know, Mabel, you asked a question about the stage of solution we are accepting. For this, looking at the feasibility criteria for shortlisting, the solution has to go beyond just an idea. It would have to be at the MVP stage, so that, or at least a mock prototype, so that we can see the feasibility for the solution for the challenge statement owners.